Our sixth and final inductee is Dr. Donald Pinkel. Born in New York, Dr. Pinkel joined the U.S. Navy in 1944 and attended Cornell University before graduating from the University of Buffalo School of Medicine in 1951. While there, he developed an interest in hematology and served as a pediatric resident at the Buffalo Children's Hospital, where he started a clinic for hematology-oncology patients. Soon after, Dr. Pinkel served as a pediatrician during the Korean War, where he contracted paralytic poliomyelitis. During his rehabilitation, he developed pediatric service and research and clinical programs at Roswell Park Cancer Center in Buffalo. And in 1961, Dr. Pinkel was recruited to Memphis while St. Jude was under construction. The facility's principal focus was research of childhood malignancies and blood disorders, and significant research resulted in the first-time discontinuation of treatment and a long-term cure. Over the next 11 years, the institution would become a leader in pediatric hematology and oncology, which Dr. Pinkel attributes to the facility's staff, patients, and families. Beyond their medical accomplishments, Dr. Pinkel, alongside Danny Thomas, pioneered racial integration of staff and patients in Memphis through their work at St. Jude. Dr. Pinkel sends his regrets for today's event as he is unable to be here. Virgil Holder, Director of St. Jude Liaison at St. Jude Children's Research Hospital, will accept Dr. Pinkel's award on his behalf. From Christopher Holden, President and CEO at Hall of Fame presenting sponsor, Envision Healthcare.
We are sorry that Dr. Pinkel can't be with us today. We know that he would very much like to be here. We know his heart is here with us, and we are happy to know that his daughter Rebecca, his first child, his daughter Rebecca is here. Rebecca and her husband and her son. So we certainly welcome them here with us today. St. Jude is known around the world for its way of advancing science, and also for its efforts to cure children with catastrophic illnesses. But our success at St. Jude is due in a large part to our first medical director, and actually our first employee number one in the employee numbering system, and that's Dr. Donald Pinkel. I didn't work with Dr. Pinkel. I joined the hospital in the early 80s, which was still a long time ago. But Dr. Pinkel had been gone about 10 years, but his impact was still very evident when I joined St. Jude, and continues to be evident, because he truly helped shape St. Jude into what it is today and to what it will become in the future. His tenacity as a scientist gave us the model of care that we still employ at St. Jude. His vision as a leader established a collaborative culture that still fuels our progress today. When Dr. Pinkel arrived at St. Jude in 1962, childhood cancer was really was considered a death sentence. But Dr. Pinkel saw that differently. He believed that cures were not only a realistic goal, but that it was the only acceptable goal. Because so often in those early days, staff, families were heartbroken over the outcome of their children with their catastrophic illnesses, and of course with cancer. More children then were lost to cancer than survived, than were saved. But in fact, the medical community of that day actually even openly mocked Dr. Pinkel's work. They wrote it off as a fool's errand. The odds were overwhelmingly against him. They were overwhelmingly against St. Jude. But oncologists often talk about something they call the magic bullet. They mean a swift remedy to the problem that's at hand. Well, Dr. Pinkel was able to help St. Jude find the magic bullet. And that was by coupling his passion and his genius along with his bravery. It's that winning combination that Dr. Pinkel had that was the foe that was needed to be the formidable enemy against cancer and childhood illness. In a series of studies, Dr. Pinkel showed that the most common childhood cancer, acute lymphoblastic leukemia, or ALL, could indeed be cured. This approach, dubbed total therapy, is still used at St. Jude and even around the world, so that today we are proud to say that with the work that Dr. Pinkel started and has continued at St. Jude, 94% of children with ALL survive their cancer. But pioneering the first cure for childhood leukemia was not the only thing Dr. Pinkel was first at. He also, as we mentioned in the slideshow, he directed the first racially integrated children's hospital in the South. He also developed the first large-scale program to address malnutrition in infants and children, which led to the creation of the Federal Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC, is what the program is called today. So we can thank Dr. Pinkel for helping us have that program today. Yes, he dared to dream of a day when childhood cancer could be cured. And we're proud at St. Jude, and we know all healthcare professionals that care for children are proud to follow in his footsteps, working each day to accelerate cures for cancer and other childhood diseases, not only in Tennessee, but around the globe. So on behalf of St. Jude and on behalf of the Pinkel family, and certainly on behalf of Dr. Pinkel himself, the man and his work, we thank you for this great honor.